Good morning and welcome back to GP Video Podcast by Nadia. Today is the second part of episode 11 in which we were talking about medication management. I know it looks like when you hear about it, it seems like it's a very trivial topic and why am I even discussing it? But believe you me, when I started working as a GP, then I realized that this is actually medication management safely and effectively and efficiently is actually one of the most major things, because even with the most educated and most learned people out there in community, they can make mistakes. And if we can effectively manage our medications, that will be solving 80% of our issues. So if we have a good understanding of our medications, how we take it, why we take it, for what duration we take it, it is going to be, so first of all, what it will do is it will, of course, cure our issues and cure our diseases. Plus, if you take medication effectively and efficiently, it might shorten the duration of the medication that you need to take it for. Because if you forget the doses, if you forget taking it frequently, daily or frequently, whatever amount you need to take, then it will only lengthen the process. It will only lengthen the entire duration that you need to take medications for. So yesterday we spoke about, first of all, you should have a complete comprehensive list of your medication summary. Either you put it somewhere where it can remind you that you need to take your medications during the day, or you have a pill container or a Webster pack that will tell you that you need to take your medications. Then I said that make sure you put your vitamins in it too. And every medication that you take, you need to make sure that you know that what is it for, what is the cause, BP, cholesterol, sugar, weight loss, pain, whatever the condition is, you should know the condition. And then make yourself accustomed with shape and color. So you should know that, if you are taking this round green tablet, what is it for? But do not get too attached to it, because the problem is, the pharmaceutical name is one for a medication, but it comes in different brands and it can come in different shapes and sizes. So for example, you went for a medication to the pharmacist and you got one brand this time, but next time you are going and he gives you another brand. So don't get confused in that it would be the same medicine, but maybe that brand is out, or you've gone to a different chemist. So please be very specific about these peculiarities. Like, get yourself accustomed with what shape and size are you taking, and you should know what medication is that, but do not get too attached to it so that you don't make any mistakes. Also, as I said, that you should know the names as well, because sometimes, as I said, the actual name, for example, because we've spoken about Ozempic a lot, the actual name is semaglutide, but it comes in two different brands, Ozempic and Wegovy. So if it's actually quite good if you can accustom yourself with the name of the medication, pharmaceutical, pharmacological, actual name, and the brand names as well. Also, yes, do not ask your doctor what does the pill look like, because I have no clue what most of the medications look like, apart from the meds that I personally take for myself. So yes, doctors wouldn't have a clue that, if you say that, doctor, that white round pill, no. I personally don't have a clue. Pharmacists would know. They usually know that. But yes, do not rely on doctors for identify your pills and all. Try and just every pill, the name, the brand, what is it for, what is the duration, what is the frequency, like are you taking it daily? Are you taking it twice a day? Are you taking it 3 times, 4 times? Even if you are taking it twice a day, let's say the tablet which is for fluid retention, Frusemide, it can be taken in the morning and in the afternoon. It doesn't have to be night and morning only. So it's all these small little details that a doctor should explain, first of all, a pharmacist should explain, second of all, and then you should try and memorize it. If you can't memorize it, put it on the notes, because I can't memorize most of the things. My memory is shocking. So I put all the things in my notes, or for my patients, what I do is I put it all in the medication summary. And also, again, what is the dose? Are you taking a 20 milligram, 40 milligram, 60 milligram? If you know the dose, that should be great. As I said, what is the frequency? Once a day, twice a day, 3 or 4 times a day? And what is the duration? Is it ongoing? Is it for 10 days? Is it for 14 days? If you're taking medication in the morning, is it the right time to take it? So for example, if you're taking an antidepressant or an anti-anxiety medication that makes you feel drowsy, should you be taking it in the morning? If the doctor has said take it in the morning, next time you can discuss it with him or her that it just monitor the side effects. If it makes you drowsy, if it makes you tired during the day, if you are on 3 pills, like let's say in the morning, and you don't know which one is making you drowsy, then what you can do is you can discuss it with your doctor, and then he might be able to say, okay, out of these 3, let's take this one. This one is the most probable to make you drowsy, so let's start taking it at night and see how it makes the difference. Also, it's interaction. So for example, you're taking 2 medications in the morning and 2 at night. You might have to take one for sure in the morning and one for sure at night, because they might have some interaction. So always ask the doctor that, you've asked me to take these 2 medications in the morning and these 2 at night. Do they have any interaction if I mix them up? Or like, for example, if I'm not wrong, iron and calcium should not be taken together. So if you are doing iron tablets, we say that do it in the morning or night, like do them opposite. Iron in the morning, calcium at night, calcium in the morning, iron at night. So something like that. So we don't make them interact. And also, as I said, note the side effects. If it's making you dizzy, report it to doctor. We can change it to night. So even if it's good for you and if it's making you dizzy, but if you are sleeping it off, then that's fine. You don't have to take it in the morning. And also, so these are all the small stuff that we need to know about our medications. And in collaboration with our doctor, we need to manage it. Thank you so much. Have a great day.